Hello, and thanks for joining our Precision Medication Center of Colorado short patient scenario regarding antidepressant selection and optimization using pharmacogenomics. Many referrals for PGx testing are related to antidepressant intolerance or therapy failure. A good trial for a new antidepressant is about 6 weeks to show effectiveness or lack thereof, and it can be challenging for both providers and patients to go through multiple trial and error processes to find the right antidepressant and right dose. Therefore, PGx results can be helpful to expedite guided therapy in this area. There are two major metabolic pathways with robust clinical recommendations, namely CYP2D6 and CYP2C19. Other areas of interest that currently lack such strong evidence are COMT and MTHFR. Let's introduce the patient scenario to demonstrate how we can optimize antidepressant therapy using PGx test results. Here we have a 53-year-old female patient that is referred to us for PGx testing and consultation to guide antidepressant therapy selection and optimization. Patient has a past medical history of intolerance and therapy failure to various antidepressants. Duloxetine failed at lower doses, and the patient is not willing or able to try higher doses because she is afraid of multiple side effects, such as the headache that she has been experiencing at lower doses. Venlafaxine elevated her blood pressure. Fluoxetine gave her insomnia and nausea, and paroxetine gave her dry mouth. In this case, we are sharing a favorite table with citation. This is a quick guide of where many of our antidepressants fit into these various pathways. There's a second area over to the right of medications that are still antidepressants but are metabolized by multiple pathways. For our patient, the genomic test results showed that she was a CYP2D6 poor metabolizer and a CYP2C19 normal metabolizer. Remember that these two pathways are the major pathways for antidepressant metabolism, so if one pathway is a poor metabolizer, it should be avoided if at all possible. Because as you can see, the patient is getting a lot of side effects from these medications, likely because of the reduced metabolic profile. Her body cannot get rid of these medications, and therefore she's getting higher concentrations and higher risk of side effects. The other major pathway here is CYP2C19, for which she is a normal metabolizer here. So it does make sense to pick antidepressants that belong to this pathway. Any antidepressant following this pathway is a reasonable starting choice. If the patient has any history of QT prolongation, it would be reasonable to avoid Lexapro and citalopram, as these two have dose-related QT prolongation as side effects. In that instance, we would recommend Zoloft. We did end up recommending Zoloft regardless to this patient. We hope this patient case was helpful to you. At Precision Medication Center of Colorado, we value our collaboration with providers and their referrals to us. If interested, feel free to view the other patient scenarios. Thank you.